Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended. And today we are discussing how to go about doing a horizontal chop, why the primary chop failed in this case, and why is it necessary to divide the nucleus into at least 4 to 6 quadrants before emulsifying for beginners. So here I intended to make a 5 to 5.25 mm of rhexis in this young patient, and let's see how this case went about. So a triplanar incision is created, the rhexis is initiated with the help of this bent cannula, and then with the utrata the rhexis is continued, and just following the path, in no time we get a nice round 5.5 to 5.25 mm of rhexis. This should do well. A little OVD is burped out, and then hydrodissection is done from one end, tapping the other end, letting the fluid come out from behind, which frees the bag and the nucleus, and it rotates nicely. Now see what happens. I'll be doing a direct horizontal chop. Bevel is turned up. Now the trick is to go in the subincisional area and then initiate the hold of the nucleus, but look what happens. I plan to do so, but as the rhexis is small, I finally end up holding the center of the nucleus and trying to go forward, but then this way we are not going to get a good hold over the nucleus, and once I try to chop it, I lose hold of the nucleus and I don't get a good crack. But now I have a crater, sort of a crater, so now I can use the walls of the crater to go deep in the nucleus and chop it. So this is a brittle nucleus, grade 3, excellent to learn direct chop, but until and unless you don't go in the subincisional area, bury the probe, go towards the center, get a good hold, then and then only you will get a good crack, which I did not do in this case. But then that crater helped me chop the nuclei further. Now the other point is, it's always better to divide the nucleus in the bag in as many quadrants as you need. So here I am dividing it in the anterior chamber, but then I have two nuclei, so I had to hold one nuclei with the chopper while emulsifying the other nuclei. Now this is a big chunk of quadrant, so I am trying to bring it up, but it's not wanting to, so I plan to not fish in the bag. Now rotating the nucleus, and you can see this base is huge, that is why it was refusing to come up. But once I chop this into smaller nuclei, I am easily able to emulsify them. So if you divide the nucleus initially into 4 to 6 small quadrants, then emulsifying is quicker and easier. Now I'm trying to bring up this epinuclear sheet. It's a thick sheet. Now as this is a karate chopper, the tip is blunt, so I can dial this epinuclear sheet with this chopper without fear of rupturing the posterior capsule. See how easily it gets rotated, and then once it flips, it hardly takes any time to emulsify. And now with these bimanual IA, an excellent tool, gives us full 360-degree access. Most of the posterior capsular rents occur while cleaning up these cortex in good hands as well. So I feel these bimanual IAs are very good in young surgeon's hand as well. And you can always switch the hands and get access to the other side of the cortex. And in no time, we are done with the cortex. There's no hurry, always take your time. You need to give a good result to the patient. And once the bag is clear, it's now time to implant the IOL. And this is a hydrophilic IOL. The leading haptic goes in the bag. And the trailing haptic is then gently dialed in. You can see that the rhexis is nicely covering the entire optic, giving an excellent stability to the IOL. And one should aim at least a 5.5 mm of rhexis when in learning stage. But once you are comfortable with managing the nuclei, you can always go to a 5 to 5.25 mm of rhexis. The case is done. The wounds are hydrated. So the take home message is, you can always learn direct chop, but keeping some important key notes in mind. The main is to get a good hold of the nucleus before initiating a chop. Keep that in mind and you will succeed in your cases. Thanks for watching.